joining us today. I think it's 2 o'clock. I think we have quite a few participants already in, so we will start the ball rolling. So welcome once again on behalf of the Exco. Today we are very happy to have Dr. Benny and Dr. Dinesh with us for this sports medicine series. So for those of you who know, the sports medicine series was our old grand rounds. And usually these grand rounds, or now we call SMS sports medicine series, they are um, actually held about 3 to 4 times every year, right? So about once every quarter. And this is aside from our annual symposium. All right, so for today, just a few ground rules first before we start. Um, just to let everyone know, Sports Medicine Association, we are more about us. We are a professional organization for sports medicine and sports science professionals in Singapore. Do check out our website here below. And if you have any inquiries about how to join as a member, please email our secretariat. The email is there as well. So we are, as sports medicine is also a very multidisciplinary field. Our members come from many professional tracks, right? So we not only have doctors, so like sports physicians, general practitioners, orthopedic surgeons. We also have our allied health colleagues, such as physiotherapists, podiatrists, dietitians, nutritionists, exercise physiologists, and sports scientists, right? Please note that we are recording this seminar, so we will be be posting this on our Facebook profile later on. And by attending this event, you hereby give your consent for your image or data to be captured for our publicity purposes. Please note that you'll be muted upon arrival, right? And you can post questions using the chat function below. Our Q&A session will be held after both speakers have given their presentations, and then we will try to answer as many as we can. Right. Also, please note that we are giving 2.5 hours of the continuing coach hours for NROC registered coaches, as well as for Singapore SMC CME points. This is pending approval from SMC currently. Please kindly give us your feedback. This is the QR code for the feedback where you'll be able to put in your MCR number and NROC details. We will also put the actual link to the survey form in our chat box. All right. So without further ado, let me F5. Yeah. Let me introduce our first speaker for today, Dr. Dinesh Sirisena. Dr. Dinesh is a sports and exercise medicine consultant with the Puat Sports Medicine Center. He graduated from Barts and the London School of Medicine and completed his sports medicine training in London before moving to Singapore. His areas of special interest include shoulder, spine, and hip injuries, ultrasound-guided musculoskeletal procedures, DNEX therapy, focal shockwave therapy, teen medicine, and pitch side care. Passionate about research and education, Dr. Dinesh, or Prof. Dinesh, also holds adjunct assistant professor titles with the NUS Yong Lin School of Medicine and NTU Lee Kuan Yew School of Medicine, and has been involved in over 60 publications, posters, presentations, and blog posts. Contributing to development of the local sports science and sports medicine community, Dr. Dinesh is also our SMAS president. All right, so without further ado, gives me great pleasure to invite Dr. Dinesh to present on the WHO 2020 guidelines on physical activity and sedentary behavior. Okay, let me stop share. Dr. Dinesh, please.
Okay, thank you, Joshua. Let me just share screen. Okay, good. So, good afternoon, everyone, and thank you for joining us. It's always a pleasure to be part of the SMAS. And over the last year, I was very fortunate to be voted to be president of SMAS, and it's a real privilege to work with such a multidisciplinary group. And hopefully, over the next hour and a half, Benny and I can sort of update you on things that are happening in terms of physical activity and the WHO guidelines. If you have any questions, you can feel free to post it, and then we'll try and answer them in the discussion later on. Also, if you are interested, being a multidisciplinary organization, we are open to members from different sort of backgrounds as well. So if you're keen to join us, do let us know, and then perhaps we can work together in the future. So without further ado, let's start with the physical activity guidelines and the updates from the WHO consensus in 2020. So first of all, I have to thank Joshua for helping prepare this. Having been arrowed by Joshua to give the presentation, I think it was an only fair compromise. So thank you very much, Joshua, and I'll try and do credit to the work that you put into putting this together. So we can all thank Joshua afterwards as well. So in 2020, the WHO released new guidelines on physical activity and sedentary behavior. And this was a update on the fairly groundbreaking publication back in 2010, which was preceded by two other papers back in 2005 and 2008, as far as I can recall. And it basically, they wanted to update all based on all the evidence that had been accumulated over the last 10 years, and sort of put new proposals together. And so, as you can see, there's a who's who of very eminent sort of individuals here in this consensus group. And I think it's very important for anyone working in sports medicine or exercise medicine to pay note of who's there and what they're saying, because I think moving forward, we have to be familiar with it, and we need to be able to translate it down to our patients. So physical activity. Physical activity is very, very important, as we know, but it's any bodily movement produced by muscle, and that requires requiring energy expenditure. Now, a lot of people talk about physical activity, but one of the things that struck me when I was reading about this years ago as a trainee and so on, was the fact that the recommendation obviously was 30 minutes, 5 times a week and so on. But there was a whole 23.5 hours where we were able to, just kind of do as we please. And I think the emphasis has really shifted away from just the physical activity onto the physical inactivity. And what we are recognizing now, of course, is that when you're physically inactive, you're not actually contributing, of course, to your time that you're moving around and expending energy. And this is of growing concern, I think, internationally, and we'll come on to it later on in the presentation. For physical activity, of course, there are various domains. So, people can take part in physical activity for leisure. So whether it's sports or whether they're doing training or preparing for some sort of event. Of course, at the moment, we are limited in what we're able to take part in terms of training for event. But we can still do this for recreational purposes. Occupation. So the S League is just about to kickstart again later this month. So all those footballers and athletes are preparing to take part in sport. And I guess we're quite fortunate that some of the sports that people do take part in are going to start up again. I know in European countries, football and various other sports did continue, but of course with different restrictions in place, some of these things may have to stop. Household activities do take part in domestic physical activity, and it's now recognized how important they are in terms of contributing to our overall physical activity levels as well, whether it's sweeping the floor, cleaning the windows, whatever it is, it contributes to our overall activities. And I think one of the domains that we tend to somewhat ignore a little bit, and something that we really do need to put emphasis on, is active transport. For any of you who know me personally, during circuit breaker, I was cycling between Buena Vista and Yishun on an almost daily basis. And that's a good sort of 24 kilometers one way. And so, if we can encourage people to take part in active transport, maybe not that sort of distance, but even if it's 5-10 kilometers on a bicycle or walking, getting off a bus stop earlier and making the effort to walk a little bit. I think without me really making a great deal of effort, we're immediately having an impact on physical activity levels and hopefully on their long-term health as well. So we can, of course, measure physical activity intensity based on things like METs. So, the very basal is 1.5, and then anything above that, you start to add according to the oxygen consumption and the heart rate as well. But a very easy way to measure it is the scale that we have here. So very light intensity, you can give it a 1 or 2. Moderate, give it a 5 or 6, and maximum intensity 9 or 10. Now, of course, the challenge with this one is it's very subjective, but at least it gives individual a way of monitoring their physical activity themselves and engaging it, so that at least they feel that they're able to quantify it and then say to themselves, I suppose, and document that they've done some degree of physical activity. And hopefully over time, and as they get fitter and healthier, they'll find that the same activity is going down the scale, and it becomes easier for them to do. Exercise is, of course, an important aspect of contributing to physical activity, but actually it's just a subset of overall physical activity. Now, the definition of exercise being a planned, structured, and repetitive activity. And when you're talking to patients, of course, there's often this misconception when you're saying, how physically active are you? What do you do? They say, well, actually, I don't exercise. And in fact, I was speaking to one of my colleagues the other day, I think somebody visiting and sitting in my clinic. And I said, so do you exercise? And they said, oh, no. And I said, oh, are you physically active? And they said, well, not really. And then when you sort of broke it down, I said, well, how did you get here? And they said, well, I caught the train, I walked to the station, and I walked here and climbed, didn't climb the stairs, took the lift. But they'd been physically active, and it had contributed to their overall physical activity levels for the day. But when you ask someone straight away, do you exercise? What do you do? And somebody says no, often it kind of closes them off a little bit. And perhaps we shouldn't be asking that question. Maybe we should be reframing it and saying, so what sort of activities do you take in? Do you walk? Do you play sports? And then opening things up a little bit. And so I think sometimes the words that we use are very, very important in terms of engaging people and encouraging them to participate in physical activity. What we do know is, of course, that physical activity is very important in terms of overall health, not only for heart disease, stroke, but over 2020, when everyone was in circuit breaker and lockdown, there was a huge spike in mental health issues as well. And there is lots of evidence to suggest or demonstrate that physical activity can help in the management of these mental health issues as well. And so I think a lot of people over 2020 really started to appreciate the advantages and the benefits that are conferred with physical activity, maybe not necessarily from their heart disease or diabetes or hypertension perspective, but really from a mental health perspective. And I think if we can somehow engage individuals from the aspect that relates to them and the hook that they find helps them to engage in physical activity, then I think we're on to a winner. If we sort of sit back and keep saying, well, you need to exercise because it helps with this, that, and the other thing, we're always going to be telling them, whereas what we want to do is be working with them and encouraging them to participate in physical activity. Of course, for anyone who exercises regularly, if you exercise regularly, you know that it helps with your sleep. It helps with your overall sense of well-being as well. And as our population gets older, we're going to have more and more concerns about things like bone health, sarcopenia, and so on. So physical activity is hugely important in all of these aspects. But I think finding the hook that puts people onto the concept of physical activity, which engages with them. I think we need to find what the hook is for them, and then we can work forward as well, move forward. Sedentary behavior, very, very worrying, particularly again over 2020. And it's basically any behavior where you're basically not expending anything above basal metabolic rate. So, sitting, if you're watching television, most desk-based activities, driving a car. So it's basically, just sitting and not expending any energy. And we know that this has a negative impact on all aspects of health as well, not just for blood sugar control and hypertension and heart disease and so on, but in terms of mental health as well. Last year there was many people who were spending many more hours in front of screens and on Zoom and in classrooms online. And I think what we may end up seeing is a huge change or a huge problem downstream. And I think it may not happen immediately, but over time we may start to see this problem as well. So what's the current state of affairs? Well, in the WHO paper that we had at the very beginning, they say that 27.5% of adults and almost 4/5 of adolescents are not meeting the recommendations. So based on the previous 2010 recommendations, this is quite worrying. I mean, yes, of course, the adults perhaps more sedentary occupations and so on. But this 81% of adolescents, the future adults, if they're not meeting the recommendations now, when they become adults, it's going to be even more problematic. And I think we really do have a health crisis potentially in the wings. And we do need to start making changes with this. The other concerning thing is that there hasn't been a huge amount of improvement in the physical activity participation, despite the recommendations and despite the emphasis from governments and health bodies to improve physical activity levels. And of course, we do recognize that there are inequalities depending on gender, maybe ethnicity, maybe on economic standing as well. And so I think, these are other things that we need to really start to engage and address. Because if we don't, we're going to have this huge health crisis in the not too distant future as these adolescents reach adulthood and as they progress, as they get older. Our population internationally is only getting older. And as a consequence, we're going to have much more significant problems later on. So why do we need new guidelines? Well, as with everything, maybe it's almost analogous to the COE. You have a car for 10 years and the technology from 10 years ago isn't necessarily always relevant to now, or you want the newest gadgets and everything. But the WHO has the recommendations from back in 2010 were based on the evidence from several years before that. And what they wanted to do was really consolidate the evidence that has been accumulated. And if you look at the number of publications based on the physical activity guidelines from the 2010 consensus statement, there's a huge amount of work that people have done. And I think trying to consolidate this and come up with something that's practical and pragmatic for healthcare professionals and government bodies to follow is really important. And we do need to update ourselves. It needs to be evidence-based so that we can say to patients and the public, look, this is the most recent evidence and we are presenting it to you in a very concise and coherent manner. But they've also this time integrated aspects for pregnancy and people with disabilities, even individuals with chronic medical problems such as HIV and so on. So they've included, they've tried to widen the population that they're dealing with. And really, one of the big aspects that I think they're focused on, and as I mentioned to you previously, one of the things that struck me was the whole sedentary time, the 23.5 hours of not necessarily having to do very much at all. They've really addressed the sedentary behavior and tried to tackle this head on. And I think moving forward, this is something that we all need to be mindful of as healthcare professionals and when we're advising our patients. And so they've also stated that they want to address the users, the end users, so us, healthcare professionals, policymakers, and I think with small changes in the guidelines that make it a little bit more flexible, but also expand its repertoire of individuals covered by it. They've tried to be a bit more encompassing in what they've done. So let's have a look at the 2020 guidelines, and let's have a look at different areas which they've worked on and some of the changes that they've mentioned. So the general recommendations from the 2020 guidelines is that doing some physical activity is better than doing none. And in the previous guidelines, they used to state that the biggest change for individuals was going from doing nothing to doing something. But actually, what they've said now is that actually, even if you are sedentary and you have a very inactive lifestyle, trying to go and do some physical activity is better than doing nothing at all. And that's particularly because many of the individuals that we've seen, so the adolescents and the older individuals, aren't doing adequate physical activity. And as a consequence, we need to try and encourage them to do some. It's important to start with small amounts, and it's about regularity and trying to gradually increase the frequency, the duration, and so on. And what we need to emphasize are the benefits of doing the physical activity and the dangers of not doing physical activity. So the sedentary behavior, we really need to address this. And I think personally, having read through the guidelines, that seems to be one of the key emphases in the guidelines this time. There's also been this change in terms of medical clearance. So previously, there was a whole discussion about pre-participation screening and people needing to check whether they were okay to exercise before doing so and so on. But what the new guidelines state is that if you're already exercising and you want to sort of increase the levels and so on, there shouldn't be any sort of major contraindications, and there's no contraindications. There shouldn't be any limitations for you to do so. But of course, things need to be done in a structured and progressive manner, and it needs to be done with care. And if you're doing moderate intensity exercise, you can increase to vigorous without medical clearance. But there is still some advice in terms of if you start to develop symptoms or if you have other long-term medical conditions and if you're not taking part in physical activity. So let's have a look at this now as well. So, do you participate in regular exercise? Well, on the right side of this, you can say yes. Do you have any signs of any symptoms? No issues? Then please carry on. If you're known to have issues, but you are asymptomatic and you've had clearance within the last 12 months, you can continue with the moderate activity. And if you want to progress that, it's best to sort of get some medical clearance. If you start to develop signs or symptoms, it's worthwhile getting this looked into before you progress, and then you can return to activity under a little bit of guidance. If you do not participate in medical, in regular exercise, and you don't have any sort of major medical, oops. Joshua, are you okay? Okay. But don't have any other medical issues. It's okay to start, but it's useful to start off at a very low level and then progressively increase. And again, the same, if you do have signs and symptoms, if you're known to have medical issues, maybe it's best to get some clearance beforehand. So this gives a very structured and very clear and easy to follow sequence for most people. So what about children and adolescents? And I don't mean to steal Benny's thunder here, and I'll go fairly quickly through this because otherwise you might be hearing the same thing twice. But children and adolescents, well, we do know that physical activity is hugely important for children and adolescents, not only for their cardiovascular as well as their proprioceptive and strength fitness, but also for their bone health. It's hugely important for cognitive performance. As somebody who has children, I know that when they've been in Zoom lessons and when they've been in doing things at home, their concentration levels dip immensely. And so getting some sort of activity, getting them to run around, go out for a walk is really, really helpful. We're also seeing a huge number of mental health issues in children as well, depression, anxiety, and so on. And I think, again, as we know that physical activity is a fantastic tool in our treatment repertoire for mental health issues, we should be helping children and adolescents with this as well. There's also the concern about obesity in children, and I think internationally it's a big problem. 2020 is certainly something that's going to be remembered as a year where this has contributed considerably to this problem. And I think we need to encourage parents and adolescents and children to exercise to try and address this issue as well. So the recommendations are that children should achieve an average of 60 minutes a day of moderate to vigorous physical activity. And this is across the duration of the week. In addition, they should be doing vigorous intensity, aerobic exercise, and strength training, or some type of exercise of that form, at least 3 days a week. The change has really been in the wording, and I think that's really important because previously it was at least, and it's now gone to an average. And really, I think this is a little bit more flexible. So on some days when children are maybe not so physically active, and on other days they've done more, it just balances out a little bit, and it gives children, parents, adolescents, everyone a little bit more flexibility in achieving the goals. I think the trouble with the previous ones, with the at least, was that it was saying, well, if you don't achieve this, you're not doing enough, and so on and so forth. But now we know that it's more about the balancing, and it's over the course of the week as opposed to on each day. The other thing is that there is a strong recommendation for this as well. And in the guidelines, they've given strong, moderate, and weak to recommendations. And this carries a lot of weight, this one. Sedentary behavior, of course, is a huge issue. And we know that it has detrimental impact on children's fitness, their weight, their social behavior as well, and sleep. And Benny will come on to this later on with the recommendations that from the statement that was being put together here in Singapore. But what we're aiming to do basically is trying to limit the amount of sedentary time. Same for adults and older individuals. We really want to try and reduce this. And this has been the big change, I think, in the guidelines. So previously the emphasis was on getting people up and active, and now it's about reducing sedentary time. And this is essentially screen time, I would say, for the most part. So whether it's watching TV, playing video games, using mobile devices, it's about trying to limit that outside of what they have to do. So many children now, of course, are on Zoom, are on online platforms for teaching and learning. And of course, we can't stop them from doing that given the pandemic that we've encountered. However, what we can try and do is limit the additional time that they are spending on screen. And what we need to try and encourage parents to do, as much as I'm sure it's very challenging, is instead of having leisure time at home in the house, is perhaps doing something more active, maybe going out for a walk, maybe doing some exercise at home. But we need to try and shift the emphasis a little bit. The other thing that they do acknowledge, though, is that there isn't a set amount of sedentary time that is okay. And if you listen to the podcast from Fiona Bull, it's one of the things that they do accept as a limitation in the guidelines. So practical note, it needs to be safe. There needs to be opportunities. Children need to be encouraged to take part in physical activity. If they need supervision from a parent, or they need it needs to be in a safe environment, then we need to make these opportunities available to them. Sometimes one of the limitations in doing exercise at home is that people say, well, oh, there's not enough space, or we don't have the facilities, or we don't have access to exercise programs and so on. And so perhaps we need to look at ways to enable this, and whether it's schools providing home-based exercise programs, or whether it's from higher up from government bodies, MOM, MOE, providing programs. We need to make it engaging, enjoyable, and children need to want to participate in it. And I think that's another key. We need to make them want to participate, rather than just putting down forcing a draconian emphasis on reducing physical activity. Reducing sedentary behavior. So what about adults? So adults, of course, 18 to 64. We know that physical activity is beneficial for almost all health outcomes. So for all cardiovascular disease, all the hypertensions, diabetes, as I mentioned previously, very, very important for mental health, cognitive health as well. And all of these blend into things like adiposity and so on. So exercises, physical activities is hugely important for all of these aspects. The recommendations are that all adults should take part in physical activity. There should be at least 150 to 300 minutes of moderate intensity aerobic activity, or 75 to 150 vigorous over the course of the week. There is an emphasis on doing more, but there is obviously a ceiling that they say as well, beyond which the benefits don't seem to increase as well. The other thing that they've added in is about muscle strengthening, and trying to incorporate this into the weekly exercise program as well, at least twice in the week. So for those of you who remember the former 2010 guidelines, it's gone from, again, a minimum to a weekly range, and the other change is it's a cumulative thing over the course of the day. So previously they recommended that exercise or physical activity should be taken in 10-minute bouts, a minimum of 10-minute bouts. But what they're saying now is that this can be accumulated over the course of the day, rather than doing it in specific periods. You can also see that they've increased the ranges as well. So previously there was an emphasis on 30 minutes, 5 times a week, and so on and so forth. And now they've increased the range, because they recognize that doing more actually is beneficial as well. So you can also obviously do more moderate physical activity or more vigorous for the additional health benefits. And it's particularly in those who do not have the contraindications and so on. I think there is still, it's still okay to say to people that, try and do as much as you can, try and accumulate this amount of physical activity over the course of the week. We understand that, sometimes you may be able to achieve it, sometimes you may not be able to achieve it, but over the course of time, if you can maintain this sort of level of physical activity, I think it's encouraging. And I think really that's been one of the big changes in the 2020 guidelines. They've acknowledged that having such firm recommendations may not have been so beneficial, and they've sort of loosened it a little bit, but also increased the spread of things as well. So, although more is certainly better, they've also acknowledged that these diminish at the higher levels. But again, there isn't this body of evidence to say how much is enough or how much is too much and so on. Certainly, if you take part in things that are very vigorous, maybe high risk, then of course the risk may not be overcome by the benefits. Again, the emphasis has really changed from just talking about physical activity to focusing on sedentary behavior. And we know now, of course, now that sedentary behavior is hugely detrimental to all sorts of medical issues, be it cardiovascular, cancer, and so on. And so we really need to be asking patients not just about how much physical activity they're doing, but what are they doing the rest of the time? I'll just give you an example here. So I remember some years ago, one of my colleagues did a project looking at footballers. So these footballers, during the week, they were training and they did like a 2-hour session here. They did another session there. And over the course of the day, they would do maybe 3 or 4 hours worth of physical activity. Fantastic. But in the other 20 hours, they were pretty much sedentary. And is that okay? Do the 3 or 4 hours of activity that they're doing balance off the hours that they're not doing things? Is doing 30 minutes of exercise in the gym enough to balance off spending 8 hours in front of the computer? So this is what we really needed to change our mindset on. And we need to start challenging individuals when they say, yeah, sure, I do exercise and I go to the gym and I do this. So what is it that you're doing there? And what is it that you're doing on the other side of the exercise as well? So we need to try and limit the amount of sedentary time. We need to replace it with exercise of any activity. So there's been this whole change in terms of people having tables which are allow them to stand, having treadmills. We need to, encourage people to have maybe walking meetings. Trying to reduce the sedentary behavior is hugely important. And of course, 2020 and the COVID pandemic and so on and so forth will have significantly affected this. But there are ways around it, and we do need to encourage and support people in achieving and reducing the sedentary activity levels. So what about older adults? So 65 years and above. So as I mentioned before, physical activity has benefits for bone health. There's this huge movement in the older individual in care, in geriatrics, about sarcopenia and muscle loss and so on and so forth. And it's really important that we encourage older individuals to exercise. There's a general mindset that as people get older, they just want to do less and take it easy and so on. But we know that physical activity can help with preventing falls and injuries, but of course also the other benefits from physical activity. But these are really significant, impactful benefits for older individuals. Also, the physical, as we get older, the risk of things like dementia increase. And if we can start to encourage individuals and their families to take part in exercise, there's not only the cardiovascular and the falls prevention benefits to them, but there's also the social aspect as well. And there's various services available. I know our hospital, they have the kampong groups, and older individuals can go there. They can do some exercise. They can, then have lunch. They have a bit of a social gathering, and then they get to go home. Obviously, this was pre-COVID, but in those little groups, you're not only helping people with their physical activity, but there's opportunities for education. There's opportunities for socializing, and this is where it really has an impact on an individual's whole lifestyle. So the recommendations were, as for adults, to try and make it, look at the physical activity over the course of the week. It can be multi-component with emphasis on things like balance and strength training. And this should be incorporated at least 2 or 3 days in the week. This is a change from the 2020, where the emphasis has shifted to all older adults rather than those with issues with mobility. So multi-component physical activity, this could be done in the home through sort of exercise programs that are delivered through smartphones or online. Or, as I mentioned previously, the kampong groups can, when things restart again, it's an opportunity for older individuals to come together and to exercise and then learn other skills as well. It doesn't necessarily have to be anything too complex, but it's great to have a combination of aerobic, strength and balance training, and it's just things like walking, lifting weights and so on. There are various resources available, and this is something from the HPB, which gives a very simple set of exercises that requires no equipment whatsoever other than a chair for older individuals to use. And they can take part in this in their home. The key with this, I guess, is regularity and making sure they're doing it and that they feel comfortable doing it and they understand why they're doing so. So if we can encourage older individuals just to participate in physical activity in this way, at least we're starting to do something. And it really goes to the that recommendation from the 2020 guidelines of doing something is better than nothing. The sedentary, the guidelines for older individuals regarding sedentary behavior is the same as for adults. It's about reducing the levels of sedentary behavior, replacing this with some physical activity time, and trying to encourage them not to be seated in front of the television for hours on end, and just not getting up and moving. Of course, I keep coming back to it, but the last 12 months have been particularly challenging for everybody. But even still, the real advantage that we've had here is that we've been able to do physical activity, go out for a walk and so on. And so I think if we can look at the positive rather than the negatives of the last 12 months, we can really start to make a difference for everybody as well. Pregnancy and postpartum, this has been included in the new guidelines. So there are certainly benefits for maternal and fetal health with reduced risk of preeclampsia, gestational diabetes, hypertension, excessive weight gain, which is a big problem for many women after pregnancy. It reduces the risk of delivery complications and postpartum depression. I mean, this is a big issue, and I think certainly we should be encouraging and making opportunities for women who have delivered to take part in physical activity if they want to, and trying to help them with dealing with the postpartum depression. In the guidelines, it states that there isn't any significant increased risk of some of the things that we're often concerned about, so stillbirth, newborn complications, and so on. So the recommendations are that all pregnant and postpartum women without complications can take part in regular physical activity throughout pregnancy and postpartum, to do at least 150 minutes of exercise during the week, of moderate level exercise, and to incorporate a variety of aerobic and strength training. Now, of course, this is for individuals without complications who don't have any issues. So strength training in particular, if they don't have any issues with the pregnancy, then by all means not an issue. But if there are any concerns, they should go and seek help. Also, adding a little bit of gentle stretching may be beneficial, but again, should be done within the limitations of the pregnancy as well. For those who are already taking part in vigorous intensity physical activity, this can continue, but of course this may need to be adapted and amended as the pregnancy continues. Again, similar to adults and older adults, the recommendations for sedentary behavior is that we should try and limit the time spent with sedentary behavior and try and replace this with some sort of physical activity of any level. And I think that's one of the keys here. We're not talking about, going and getting up and going for a run. Even just going for a walk or taking the stairs if it's possible. These are the key things that we need to encourage people to do. Physical activity isn't just about going to the gym and doing exercise. We need to really change this emphasis a little. Practical notes for pregnant women and those who are in postpartum. If they're not doing anything, this will confer benefits. We can start off small and gradually build up. Now, of course, as the pregnancy continues, it may be more challenging for individuals to participate in physical activity. And these are things that we obviously need to acknowledge. But if they are able to cope with the stresses, then we can gradually increase things over time. Pelvic floor training can certainly help. And certainly help with some of the issues postpartum, so issues like urinary incontinence and so on. And it's always, it's great if we can encourage women to participate in physical activities as soon as they feel comfortable to do so. Now, certainly with things like cesarean sections, it's obviously quite traumatic. And once they've overcome the operative phase, just checking with somebody that they're okay to return to strength training and physical activity would be the best option. Some of the safety considerations are obviously avoiding physical activity in excessive heat or high humidity, making sure hydration levels are suitable, avoiding physical contact, so taking part in contact sports or contact sports basically, and reducing the risk involved in sport. Also reducing activities in a supine position after the first trimester, particularly because of the gravid uterus compressing the blood flow. If they do feel that they have concerns, or if there are complexities from the pregnancy, seeking supervision, particularly also if they're going to take part in competitions, or if they're going to exercise above what's recommended. And also just educating people to what to look out for. So if they have bleeding, or if they feel lightheaded, or if they have pain or something, just really to try and consult someone as soon as possible. And just educating patients is really key in this aspect, I think. So people living with chronic conditions. So for individuals with chronic conditions, physical activity is also safe. And it's important because we certainly know that for individuals with chronic health conditions or disabilities, it's very, very beneficial for their disease as well as their overall health. There's evidence out there for cancer, diabetes, HIV, and so on. And actually, we know that these things are, physical activity is beneficial in these situations. Some years ago, when I was a trainee, I was privileged enough to visit Bart's Hospital, and they have an excellent cancer rehab program for individuals with prostate, breast cancer, and so on and so forth, who've recovered. And what they found was that those who participate in physical activity actually have much better outcomes and a much lower chance of recurrence as well. So, we really do need to encourage people to participate in physical activity. So as mentioned, and as many of you know, PA helps with heart disease, reduces the risk of cardiovascular disease and things like diabetes. There are stories of people who have come off their diabetes medication and hypertension medication simply from doing physical activity. And these are some of the case studies. Maybe doesn't apply to everybody, but these are some of the case studies we should use as examples when describing things to our patients. So for people with cancer, as I mentioned before, particularly in breast cancer, colorectal cancer, prostate cancer, exercise is hugely important. And I think this is one of the key things that we should be discussing. For one of the new things in the 2020 guidelines was about HIV and how it's okay for individuals with HIV to participate in sports, how it can help their general health, and it doesn't significantly change their viral loads or CD4 counts. And so, whereas previously there may have been an emphasis on reducing activity levels, trying to kind of conserve their health and so on. What we now know is, particularly with new anti-HIV medicines, and people's lives are being prolonged and they're actually having almost normal lives with very low viral loads. We can encourage them to get back to normal activities, to participate in physical activity, and hopefully have a long and fulfilling life. And as we have mentioned before, mental health, huge implications from physical activity. And I think this is something that we really need to emphasize moving forward. So for people with chronic health conditions, the sedentary guidelines are the same. So trying to limit the sedentary activity, trying to replace some of the sedentary time with some physical activity. In fact, any physical activity is better than nothing. And then trying to do it within the limitations of your illness. So, if you're maybe don't feel up to going out for a walk, maybe just moving around the house or doing one of these home-based exercise programs may be suitable. It's probably advisable to suggest to individuals who do have chronic medical problems to seek advice and see how things like their control of a medical condition, their medications may impact on their ability to participate in physical activity. And I think with our improving knowledge of physical activity and its relevance to other medical problems, we should be trying to incorporate these elements into treatment plans. Maybe not necessarily, throughout the whole course of the medical treatment that we're dealing, condition that we're dealing with. People with disability. So, there was evidence that they looked at evidence for all sorts of medical issues or disabilities. And what they found was that, again, physical activity has benefits for all of these. They looked at things like comorbidities, physical functions, cognition, and so on. So for patients or individuals with disability, physical activity is safe and beneficial for them, provided there's no significant contraindications. There's no major risks. If there's no major risks when appropriate to the physical activity level and the health status. So for most individuals, there may be certain activities that they're able to do and certain activities that they are unable to do. And we just have to kind of work around what they can manage and try and encourage them to participate in activity. I'll give you an anecdote here. So some years ago, I think I was a third-year registrar or maybe finishing. I think I was a registrar at the time. And I was asked to go and give a talk to it was in the west of England. And I was there talking about the benefits of physical activity and the need to participate in it and so on and so forth. And there were two individuals in wheelchairs, and they completely gazumped me when they said, well, you're talking about going for a walk and taking part in physical activity. What about us? And I was completely gazumped, and they said, so what can we do? And I said, well, I guess you can swim. And they said, oh, well, we don't swim. And then I said, well, okay, you're in a wheelchair, maybe, wheeling around. And I don't think they were particularly impressed by my response. But when I left and I thought about it, I realized that, there aren't many things that you can take part in doing. You can do upper limb strength activities. You can still raise your heart rate by taking part in exercise just from the upper limb. And then in 2012, I was fortunate enough to help at the Paralympic Games. And I was simply blown away by what people were able to achieve, despite huge limitations. I saw a bilateral below-knee amputee run the 200 meters. I saw, people doing sprints in wheelchairs and all sorts of amazing things. And it just made me realize that even though I'd come out with a really terrible answer for them, there are things that I should be more aware of, and I should be able to share with my patients if they have disabilities. So I think we need to have a think about what the limitations individuals have and how we can work around things and what we can do to support them with their exercise endeavors. Again, so the recommendations, though, are trying to reduce sedentary time, same as for adults. Of course, this is a bit of an issue in individuals who use wheelchairs, who maybe have issues with mobility and so on, may not necessarily have the strength to participate in overall bodily activities and so on. So it's doing some. I think the emphasis needs to be on doing something rather than nothing. And it's about working through the limitations that they encounter. So, using sedentary behavior rather than sitting and allows us to then bypass the mentality of individuals saying, well, I'm sitting down, so, well, how do I work around it? And so instead of saying sitting, well, they're saying you're sedentary. But even if you're sitting, you can still do activities. So using your upper limbs, I remember years ago when I used to go to the local sports complex where in London. Every morning there was a guy. For a period of time I went every morning, and there was a guy who came in. He strapped a float to his legs, and he used to just swim freestyle. And then he used to get out, and you could, he parked his wheelchair by the swimming pool, and he would climb out and get into it. And it's really inspiring to see people like him doing that, despite his limitations. So the key messages are this: for all populations, the benefits of physical activity and limiting sedentary behavior outweigh the potential harms. The risks can be managed by gradually increasing the amount of physical activity, so the duration, the intensity, and so on. The key message, I think, is that some physical activity is better than none, and those who don't take part in anything should start with small amounts and gradually increase. The big message, I think, from all of this is sedentary time. And we should be emphasizing to individuals that even if they are physically active in the sense that they take part in exercise for a certain amount of time, reducing that sedentary time is important. And I think it will be interesting to see what the outcome of this, the pandemic, and how things move forward in the future. What are the changes that we're going to see in population health and in the well-being of everybody? I think we'll take questions. Benny and I will both take questions later on. But thank you for your time, and I'll hand over to Joshua.
Hi, hello. Okay, thank you, Dr. Dinesh, for the talk. Next up, we have Dr. Benny.
Yeah, let me stop sharing. Sorry.
All right, so it gives me great pleasure to introduce Dr. Benny. So Dr. Benny Loo is a consultant pediatrician working in general pediatric services and sport and exercise medicine services at our KK Women and Children's Hospital. He graduated from the Yonglin School of Medicine in NUS and completed his SingHealth Pediatric Medicine Residency Program at KKH. So in 2020, he joined the Sports and Exercise Medicine Service in KK as part of the SingHealth Duke NUS Disease Center for Sport and Exercise Medicine. And he chaired this particular work group on the development of the Singapore Integrated 24-Hour Movement Guidelines for Children and Adolescents. He is an adjunct instructor with the NUS Yonglin School of Medicine and the Duke NUS Medical School, and is also the honorary assistant secretary of the Singapore Medical Association. So without further ado, it gives me great pleasure again to invite Dr. Benny Loo to present to us our Singapore guidelines. Dr. Benny, please.
Thanks, Joshua. Let's just start sharing again. Okay, I hope you all can hear me, and I'm on the presentation mode.
Yep.
Okay, thanks, Joshua. So first of all, thank you all for joining the talk, and I want to thank SMES for inviting me to share. And also that for all the images I've used, search using the web, and all the copyrights belong to the rightful owners. So without further ado, I'm just gonna dive into the topic of the day. So I'm gonna give a bit of introduction on how KKH started up with the sports and exercise medicine service, some of the background of the physical activity and also the sedentary behavior in children in Singapore, what's happening here. Then we will talk a little bit more about the guidelines, some of the resources that we hope to share with everyone, summary. And if time allows, then we will share the video presentation that we showed during the presentation of the guidelines itself, but if not, we'll move on to the Q&A. So thanks, Joshua, for the very kind introduction. So I started my medical career with the NUS as a medical student. So after that, I kind of like been a SingHealth person. So I've done my pediatric residency under KK Hospital. So it was actually quite opportunistic that KKH is literally the new kid on the block in sports medicine. So we are one of the latest addition to the SingHealth cluster-wide sports medicine initiative, sport and exercise medicine initiative. So we officially launched last year our pediatric sport and exercise medicine service, and we're still in the very early stage as well. So we will need to everyone's support as well. Personally, I'm a father of 3, and my youngest is 6 months old. I'm at home. If you hear some child crying, do pardon me. All right. Okay. So I think Dr. Dinesh has covered quite a bit of the content on physical activity, and also that I'm sure a lot of you have probably more knowledge than I do. I'm also a new person into sports medicine field. So through our project, we also found out that specifically for children-wise, for non-communicable diseases is coming out as a more of an important problem for children. And we all understand that it's driven by lifestyle factors, such as physical inactivity and lack of physical activity, as well as diet. And of course, as highlighted earlier, childhood obesity, it is kind of a worldwide epidemic of the 21st century. And definitely the COVID-19 did not help this as well. Well, we have come up with many creative ways to try to treat childhood obesity, and I can assure you that we are still trying to come up with better ways to treat, because we have dedicated clinics to see these children. But all research has shown that prevention is the most feasible method. And I think that to encourage good child health and also to reduce the child obesity, it cannot just depend on pediatricians. We actually need the entire medical community. So what do we have so far? So we do have physical activity guidelines, and I think Dr. Dinesh has shared on the recent WHO November 2020 guidelines. So we do have, it's just that all these guidelines, more conventional guidelines, they focuses on the physical activity part and the sedentary part. So as more research comes in, I will touch on the new points, and which are also very important and relevant to us. So this is the previous guide. This is a 2010 WHO guide. All right. So I to share that they talk about physical activity as sedentary guidelines. And I think the 2018 American guidelines also focus on the physical activity as sedentary behavior for children as well. We also have our own version from Health Promotion Board. I must say that it's a very detailed report that was revised back in 2013. So the main thing was that it also touched on physical activity, they touched on sedentary behavior, and they have included some safety component as well. So these are our current guidelines that we are using. But there is definitely more evidence coming up. So one is that we understand more about light physical activity, because the conventional or traditional focus is on moderate to vigorous intensity type of physical activity. So what about light intensity? And of course, we know sleep is important for children, for adults, for adolescents, but what is the role of sleep in metabolic health, and also role of sleep in obesity? So therefore, we are trying to look at the relationships between all these different activities. So this concept of a 24-hour movement guidelines is not, we are not the first country to adopt. So the first country to do so was actually Canada. So Canada did a very robust systematic review of the various domains that I will summarize later on of these 24-hour movement guidelines, as well as the relationship between these activities. The research is so robust that both Australia, so Canada rolled out in 2016-2017, Australia followed in 2019, and Singapore followed in 2021. So Australia guidelines, Singapore guidelines, and even the most recent WHO November 2020 guidelines for the children part, we actually base a lot on this very robust systematic review done by the Canadian friends. So they have done a very, very fantastic job. So what's novel is that they integrated all these movements. So they use movement, we use activity. I'll touch a little bit more why we use activity. So touch on movement. When I say movement, it includes light physical activity on top of the MVPA, moderate to vigorous intensity. They touch on sedentary behavior. They touch on sleep activity, or so-called sleep as a kind of a movement, a resting movement, if you want to take it that way. So on top of that, so what we felt was there's one more key component that we should try to integrate as well, which is eating habits. So that's why we term our guide as an activity guideline, so as an eating activity, because it is part of the metabolic cycle of energy in, energy out. So looking back, there's actually quite some studies done on our children locally. So back in 2008, so 2008, Prof. Michael Chow has done some studies and showed that our children back then can only meet up to 40% of the recommendation. So the recommendation at that time was at least 1 hour of MVPA, moderate to vigorous intensity per day. So the children and adolescents can only meet about 40% of that. And subsequently, in another study by Teck in 2015, out of 233 adolescents being studied, none of them actually achieved the physical activity recommendation. And also all these studies are very good because they actually use accelerometers to look at their physical activity level. So this is actually very, very worrying. And on the other hand, on sedentary behavior, so in 2006 by Lee, so showed that actually 70% of the adolescents exceeded the 2 hours of screen time. So I think we have really touched on about this screen time that we should limit as much as we can. So based on what we understand about these 2 hours that you've seen before, that was also endorsed by the AAP, American Academy of Pediatrics before, was because it's very hard actually for the researchers to find the absolute limit whereby there is adverse health effects. But most of them by convention use 2 hours, and they showed that at least if you exceed 2 hours, there are definitely some related effects. And that's why most of us adopt these 2 hours. And of course, moving on, we have come off trying to even come below the 2 hours. So back to the Teck study in 2015, the average sedentary time of those 233 adolescents was 5 to 6 hours per day. So, and I will tell you that, to be frank, it's probably higher than what the research shows. So we also did a kind of like pilot study or a short study of children between 5 to 14 years old last year to look at what are the current activities of our children here. So you can see that in general, more than 20% of these 100 participants are at risk of one or more of the activity in terms of physical activity, sedentary behavior, sleep. All right, and you can put screen viewing together with sedentary behavior. So in just to this is taken from our statistics. So just to quickly bring it through. So basically, is that 43% do not engage in vigorous physical activity, and 25% of them have more than 10 waking hours engaged in sedentary behavior. 20% of them are not meeting the required sleep duration on weekdays, and 20% of them spend more than 4 hours of screen time. But of course, we must bear in mind that this is a COVID year. So this is probably abnormal, but as we move on to the new normal, some of these might stay. So we have to be wary as well. We also surveyed the parents that didn't know if there are any guidelines and are they worried. So frankly, as parents, all parents they are worried, but the thing is not all of them know about guidelines. So on the same note of obesity and overweight, so the statistics from MOE showed that our school children, the proportion of overweight school children has increased from 11% in 2013 to 13%, so 11 to 13% in 2017. And HB has also found out their statistics that out of 10 primary 1 7-year-old who are overweight, 70% of them will grow up to be overweight adults. So if you ask me, I think that the HB one is a very scary statistics. So that means that if I cannot help them at a young age, the burden will go on to the adult physicians, adult sports physicians. So we have to stop them or to build a good lifestyle and habits from a very young age. For that, we move on into our Singapore Integrated 24-Hour Activity Guidelines for Children and Adolescents. So this is for apparently healthy children and adolescents, definitely children with chronic conditions or disabilities. For those, we will advise them to refer to our sport medicine for further advice. The age group is from 7 to 18 because this is to align with the current HPB physical activity guidelines, which is for 7 to 18, which I think is most likely because of our current school system. And of course, beyond 18, most of them enter military service for the boys. Okay, their acknowledgements, I'll leave it at the back. This is definitely not a one person's work. It's actually a work group supported by a myriad of organization support. So the first statements wise is the overall aim. So we want children to have to aim for physical, mental, and social health. The children and adolescents should acquire a lifestyle that integrates regular physical activity, limited sedentary behavior, have adequate sleep and good eating habits within each 24-hour period. So I want to bring up this one is that number one, we focus on is not just obesity. We are talking about good overall health, including your mental and social. We are also talking about integration of all the activities, which there is some evidence at subsequent guiding statements. And also the third thing is the 24-hour period. So I will tell you that from my experience is for almost all children, their first priority is studies. Number two, homework. By the time they tell me that by the time I finish my homework is already bedtime, sometimes it's very hard for us to tell them that you must go exercise. You go exercise at 11 p.m. at the expense of sleep. Is that a good idea? Is really a tussle. Yeah, it's really not easy. So we want to kind of emphasize that time is finite resource, but not just to the parents, but to all the stakeholders, that we need to balance what is important for the children and adolescents. For physical activity, accumulate at least an average of 60 minutes per day of moderate to vigorous intensity physical activity in a week, and we encourage them when more is better. So basically, this one is aligned with the latest WHO guidelines. The other thing we built into this guide is that we will give them resources to monitor about the intensity, which also was shared at the beginning of Dr. Dinesh's slide. It's just that for like pediatricians, for parents, and the children might not be easy for us to explain. So that's why we have the resource. Similarly, this is also quite similar to previous guidelines to engage in muscle and bone strengthening exercises at least 3 times a week. And we also allow them to build this into their weekly requirement, because if not, I would tell you that our children here are really very heavily involved in studies as well as their CCAs. So we have to make it practical for them. So we also give some suggestions what they can do, like maybe just do climbing stairs or just use resistance exercises. So this is something new on light physical activity. So I think this is not talked about much before. So based on the systematic review done by the Canadian friends, they realized that if you do a regular light physical activity, it actually helps you to reduce your cardiometabolic risks. And this is probably more of a direct effect. Probably the indirect effect is that it helps to replace your sedentary behavior. So that's probably why we encourage you to do as much physical activity as possible. And simple things like just choose active option, just climb the stairs instead of escalators. And also children, especially the younger they are, they definitely need outdoor play. So that's why COVID-19 was a really very difficult year for us to encourage them to do exercise. We also have a suggestion. They can use 12,000 steps or more daily for the adolescents as a guide of how much light physical activity they want to achieve daily. So there are a few studies whereby they have shown a range whereby it's about between 10,000 steps to up to 15,000 steps. It may be different for gender as well, where males usually requires a little bit more steps. So we have taken the consensus of 12,000 steps for both genders as a good minimum of steps to achieve daily. So previously you work with the limit of 2 hours of screen time. So now we said that please limit your recreational screen time as much as possible. So you realize that we're putting recreational is because we know that this is a new normal. Home-based learning is here to stay. We are doing this via Zoom already. This is the new normal. So it's very hard for us to say, please don't have any screen time. It's impossible, to be frank, even all the way to the preschool. So what we want is that, okay, you have a fair share of screen time for your studies, but it's time to take a break from screen. Please limit your recreational otherwise. We still allow the practitioners to use 2 hours as a limit. So we would share with the parents that if you do 2 hours or more, we can guarantee you that it's more negative health effects. On the same note, for sedentary behavior, we strongly encourage you to build in regular breaks or movement breaks, all right, during periods of prolonged sitting or inactivity. So we try to make it simple for the practitioners and public to understand, rather than we say that just really sedentary behavior. So we suggest that you can take a 3 to 5 minutes break, just stretch yourself, move around for every 30 to 60 minutes of sedentary physical inactivity. So this is most likely when they're at home, they need to do their home-based learning, they need to do their homework. I think this is a guide for, let's say, the parents to help to give them some break in between. So sleep. So sleep is not new, but it is definitely new in so-called physical activity guidelines or activity guidelines. So this is also aligned with the current health promotion HPB guidelines, health promotion board guidelines. So this is from the National Sleep Foundation, whereby from 7 to 13 years old, they should have at least 9 hours. The range that is recommended is 9 to 11. For 14 to 17 years old, you should have at least 8 hours. The range is 8 to 10. And for the 18 years old, is at least 7 hours. So the range is 7 to 9. The reason is also based on experience, is that most our children is sleep deprived. So we want to emphasize the minimum number of hours. And the main thing is we want to encourage regular, and if possible, it is the night sleep we're focusing on. And also that if possible, to have it earlier as well, because all these have secondary effects, positive health effects to the child. But basically, we will say please sleep regularly, and also please have the minimum number of sleep. We want to bring attention to their parents and the child that it will help you to improve your learning, either directly or indirectly, such as having adequate rest, so they have better attention span, and also that if you have insufficient sleep, it might give you increased risk of obesity, and that could be one of the reasons why the child or the adolescent cannot lose weight successfully. So safety. So we also continue with the HVP's take on safety as well. We think this is a very important statement to as a guiding statement, that they should take the necessary precautions such as appropriate equipment, footwear, warm up, cool down. I'll tell you that it's always not easy to warm up, cool down a very eager, preschool or younger primary school child before the activities. But I think it's important, and also that in Singapore's climate, they definitely do need to be very well hydrated, and also to see a doctor if they feel unwell during exercise. And if you, I think most of you will be familiar that persistent chest pain, breathlessness, dizziness, bone or joint pain, these are all part of the pre-participation screening questions. So again, this is something not new, but it's new in that it's an integrated activity. So about eating habits. So we want to complete the metabolic cycle by encouraging the children to have regular meals consisting of nutritionally balanced foods and drinks for their daily activities. On top of that, they are growing, so they actually need more for their puberty, for their maturation, as well as development. So it's a little bit different from adults in the sense that adults, you support their daily activities. But for children-wise, they have another component of the growth that we have to actually cater to. So whatever they take actually may still be a little bit higher than what you might expect because of this growth component. We want to emphasize regular meals because number one, I would say that based on experience as well, a lot of children are not taking breakfast. And this is not just Singapore problem. I think Malaysia has done a few studies as well on the breakfast eating habits in their school children, and it's quite a common phenomenon that they do not take breakfast and just go to school. There is some snowball effect. I've seen children whereby they don't take breakfast, and then they have a very irregular eating pattern, resulting in a very late dinner, or they take supper, and all this build to very poor cardiometabolic health. So we want good eating habits, and they should eat as a family, inculcate good eating habits. There is some overlap between nutritionally balanced or so-called healthier choice food. We purposely use the word nutritionally balanced to emphasize on the need to look at nutrition, because if you realize the healthier choice does not always mean that it's healthy, it's just healthier. So for example, like some sweetened drinks, they have healthier choice. But if let's say if you can, you should not be consuming these sweetened drinks. So therefore, we want to focus on nutritionally balanced. So in general, definitely you should include vegetables, fruits for them, choose of whole grains, choose of lean meats, and definitely must cut down foods that is high in, let's say, fats, trans fats, or saturated fats, as well as high salt, as well as high sugar products. For portion wise, please use the My Healthy Plate. And actually for the different age group of children, the Health Promotion Board has also some guided portions as well. So last but not least, this is our last guiding statement. So we then emphasize on the integration of all these activities. So this is another new area that the evidence has supported. So if you can actually start with one or more, you have better effect. So it's almost like a dose response relationship. That means if you do one, you do all, you have the best response. You do three, you have better response. You do two, you have good response. You do one, you have some response. It's like that. And what's good is that there's no specific pattern. If I can't do sleep, for example, but I can do physical activity and sedentary behavior, please go ahead. If let's say I can't do physical activity, but I can do sedentary behavior and sleep, please go ahead. You probably will achieve similar kind of effects. For the Canadian studies, they do not take into account the eating habits. So they only focus on the PA, SB, as well as sleep. The last thing is, of course, we want them to have a, to kind of like build up the progressive milestones to encourage the children to do. I will tell you that children will kind of give up quite easily because they need it to be fun and they need a lot of encouragement. So we really want to emphasize that the family has to move together with the child. So some resources, as mentioned, we included this intensity guide for the children. We use the breathing and heart rate. We use the talk test. And if they want to use a heart rate monitor, we use that as well. We also included some domains as was covered by Dr. Dinesh. We have a sample activity guide to suggest some of the activities they can do, but this is not an exhaustive list. So these resources are actually available to the public. So you can just go to the Academy of Medicine Singapore website, you go to College of Pediatrics and Child Health, you go to their publications, and then you go to AMS Clinical Guidelines, or the link is there. So we have two main versions. One version is so-called the full version. So it's like a journal paper version, and that is to include all the evidence as well as supporting information more for practitioners' reference. We have another one is a so-called brief version that which I use most of the information in this set of slides. It's more for how a practitioner can communicate to the public, and more for public use as well. I'm in the process of developing infographics, such as a patient leaflet or patient pamphlet that will help to bridge this communication between the practitioner and the public. And once it's ready, it will be uploaded on the website as well. So stay tuned. In summary, so I came up with this after I was asked to do this presentation. So I was thinking that at the end of most of the presentations, you need to have a take-home message, right? So my take-home message is 6 S's, all right, on top of the summary, so 7 S's. First thing, think about sport. Think about regular physical activity, whether it be light, moderate, vigorous, muscle, or bone strengthening activities. Think about slack. Please limit your sedentary behavior and specifically screen time because of the new normal, the use of all these electronic devices. It is very important. Definitely think about sleep. You must have adequate sleep in order for you to have enough energy for learning and for the physical activities the next day. Think about safety. All right, you must exercise safely. If you have concerns, you have medical conditions, just consult us before you engage in all these exercises. SUP, which means to eat or to drink. I don't think it's a common word used here. So SUP means to adopt good eating habits, have regular meals, all right, and choose the more nutritious type of food. And lastly, score. So if you can do most or all of these recommendations, you will score in a good cardiometabolic health. So some acknowledgements here. So as I mentioned, this is a fantastic teamwork by academics, by family physicians, sports physicians, pediatricians, across, it's a nationwide collaboration in the work group, and it's produced by the College of Peds and Child Health, supported by the research grant IPAMPO, and also supported by HPB, and definitely partnered with multiple medical organizations, including SMAS. And thank you again for the invitation. So please, you can email me at this email if you have any questions or if you are keen to partner in some projects. Also to share with you all is that we are doing an Asia Pacific understanding of children and adolescents behavior. So this is our Singapore participants. So if you have children between 5 to 18 years old, please help my colleague to do this survey. I think it takes about 10 minutes or less. Joshua, could I just check if we have time for the video? If not, we can move to Q&A.
Sure, Dr. Benny. Yeah, the video should be good.
Okay.
Good to go.
It's a short video. This is the presentation of guidelines at the Asia Maternal Health Conference.
Oh, the music stopped. Okay, no music, but the thing is still playing, so I think we can just continue.
Sorry, Joshua.
Oh no, the music stopped. But
I'll stop.
yeah, but I think we can just play the slideshow. I think.
Okay, yeah, we resume.
Just
Sorry,
resume. Yep.
sorry. Yeah. Oops. Okay. Let me check. See if we can resume here. Okay, maybe I will just then facilitate since there's no music. Okay, thank you, Joshua.
Thank you very much, Dr. Benny. Okay, we have come to the end of both our presentations. Just want to take this time again to thank Dr. Benny and Dr. Dinesh for their enlightening speeches and their presentations. We will currently now move to Q&A, but before that, just want to remind everyone that we are still accepting questions, so do check them in the chat box. For those who doctors who are claiming their CME points, as well as coaches who want to log in their hours for the continuing coaching education, please fill up the feedback form. The feedback form link is also in the chat. Even if you're not claiming any of those points or hours, we will really appreciate your feedback as well. So please give us your feedback. Yep. So I think without further ado, we will go on to some of the questions. I think right in the beginning, we have a question from Dr. Tay, and I think it's for Dr. Dinesh. It's regarding the guidelines from the WHO 2020 guidelines that we just presented versus the American Physical Activity Guidelines in 2018, which was also alluded to in Dr. Benny's talk. And the question was whether there are any differences between the two.
Thanks, Joshua. Dr. Tay, I think the key difference that I can see looking through both of them is that the WHO guidelines has other groups included, including patients with HIV and so on and so forth. The the general sort of gist of things is very similar for both guidelines. So I think, as you know, with many of the WHO recommendations, a lot of the evidence comes from the US and Canada and things like that. So it's very likely that they've taken elements of that from the American guidelines as well. So that seems to be the key difference. Beyond that, reading through it, it looks fairly similar. So yeah, so I guess the WHO is always going to align with one of the major guidelines, which is the US one. So.
Yeah, and I suppose it's good that they are similar, if not the same. If not, people will start getting confused, right? If everyone sings the same song, then it's good. Yeah.
So,
Dr. Benny, oh yeah, there is a question for you regarding if there are any local guidelines or data regarding physical education, physical activity for even younger children, those less than 5 years old.
Yeah, thanks, Joshua. Okay, so for the HPB, when they, the National Physical Activity Guidelines that I've mentioned that was revised in 2013, they actually covers for children from very young all the way up to 18 years old. So there is a component for children less than 7 years old or less than 5 years old as part of the group as well. So just to share that regarding this 24-hour integrated movement, so actually both Canada and Australian have the guidelines for children 5 and below. So for them, for their children, they start from above 5 years old. And for the so-called younger group, they start from 5 and below. So they also have a 24-hour movement, integrated movement guidelines for that. So that is for us the next step to how to bring back to the local settings as well. So in summary, yes, we have. It focuses on physical activity, sedentary behavior / screen time, and safety. So it's not the integrated form.
Okay. The next question also is for Dr. Benny. There's a clarification regarding the step count. So 12,000 steps for children, but in general, but for boys need to do more. Unsure whether I heard the latter part correctly. If that is so, what are the reasons? What are the reasons for boys needing to cover more steps?
So it's correct. So there are a few papers that do steps count in adolescents. So so one of the paper did show that the males actually need a higher number of steps to actually achieve the physiological response that that to improve their cardiometabolic health. So probably it's related to as in for physiologically adolescent males probably needed more stimulation. So for them, the males may need up to 15,000 steps to actually achieve the effects. And whereas the females maybe about 12,000 or 13,000, they might be able to achieve. On the other hand, they actually, there's also 1 or 2 studies that show that 10,000 steps might be enough as well. So there's actually a whole range. So therefore, we use 12,000 because it seems to be the minimum for both males and females in most papers, or at least the range, if it falls below 12,000, it does cover the 12,000 steps. Yeah, so most likely it's related to the gender physiological changes in the adolescent period.
And for these steps, are they? It's like if you go for a run, you count those steps inside as well. Was that how it was calculated?
I think that's a very good question. So actually, we did have that discussion. I'm not sure if Dr. Dinesh should remember, we had that discussion as during the work group. So I think for practicality, we allow it to be counted. Yeah, as best as we can, we still encourage MVPA versus light physical activity. But if let's say that you want to talk about encouraging physical activity in general, we will also let's say we'll count the steps as part of the 12,000 steps if you're doing a run. Because to be frank, if you can do a 12,000 steps as a run, I think the quality of physical activity is so much better. Yeah, than walking 12,000 steps.
Thank you. Any personal recommendations that you have found to help your kids to do more physical activity?
Okay. No, I think what I like about us embarking on this journey is to give the practical approach. Because if you ask me, my oldest one, I'm sure some of you are parents here. So my oldest one is in primary school. So we can understand that school takes away at least more than half a day of the child's time. So what's left is how are we going to help them to achieve this physical activity, sedentary behavior on top of their enrichment classes if we send a child to. or on top of the how homework they need to do as well. I would say first thing first, try to make it a regular activity. And I must say that for my children, they can't expect that when I'm home, we're going out for some physical activity. So this is just regularity, that this is expectation. So this is number one. Number two is that for children wise, they need adults. So if you ask them to go out, maybe adolescents, they might be able to do so, but adolescents actually tend to exercise probably more with their friends, maybe some older siblings. But for the younger children, especially the lower primary, the preschool, they need their family support, they need the adult figure. So usually is I have to bring them out or they will ask me to go out. So this is the other thing. Third thing is that I think try not to be too worried about MVPA, try not to be too worried about 1 hour. I think the main thing is go out, have fun, and just try to do it as much as they can, and just encourage play. So the good thing about children is that I will guarantee you, they will actually do more M and V than adults. Because you ask them run, they will chomp, they will just sprint and everything. You ask adults to run, we will give you the action, but not the effort. So children-wise, very, very easy to play with them. And they actually can achieve the so-called required intensity very, very fast. So I think the main thing is to make it fun, make it enjoyable, and then just maybe just do it regularly and do it as long as you can. Maybe I just add one more point, just to highlight about these services. I must comment about our community building. As long as you see HDB block, you will see one tool you can use, playground. As long as you see HDB block, there's always a playground there. So one of the things I did my kid was actually we just explore the different playgrounds around my community area. So I think this is one of the major assets that we should actually take advantage of.
Yeah, so I think really, for especially for younger kids, us adults or the parents are the ones who are the ones that should be more active and then bring the kids along. So I think it's, yeah, if the adults are not active, it's very hard for the kids to be active. It's very hard to, unless, I mean, usually we want to say act by example, right? So yeah, so I think that just highlights this point very well. Yeah. Okay. Are there any more other questions? If you would like to voice out your questions, that's also okay at this point in time. Yeah. If not, I just remind everyone again, we appreciate your feedback. The feedback form link is in the chat. Okay. If we have no other questions, I think I'll just use the time again to thank Dr. Dinesh and Dr. Benny for coming on to speak to us this Saturday afternoon. We will move to close this session. Is there anything else you would like to say, Dr. Dinesh, Dr. Benny?
Thanks, Joshua. Well, thank you everyone for joining us. It's always a pleasure to see everyone join and listen to the talks. I think as 2021 progresses, hopefully you can come and join us for the next series, which Joshua is helping with, correct? Is that right, Joshua?
Oh, sorry. I'm sorry. I'm looking at the next question below. Sorry, that's one from Dr. Benny. Sorry. I think we just use this time to just ask one last question since everyone's still here. What is a good mix of strength and cardio for kids below 10 years old?
Oh.
Okay. So for children wise, they are very dynamic. So for the less than 10 years old in general, they prefer more kind of dynamic kind of activities. So it's more of running type of activities, so that will help to build the cardio. So in general, for strength wise, what I usually do is that I will build in some climbing activities, or build in so climbing in terms of stairs, or climbing in terms of the playground, the ladders, the platforms. So usually I try to mix between some running activities with some climbing. So like a good example is that I will play is that we will have some running towards a safety house at the playground. And the playground generally have a platform. Then the multiple ways to go up. So once you had the safety house, then technically I cannot catch you. But then the next part is try to how to kind of encourage them to move on to the next point, so they need to come down and they'll do some running and climbing again. So basically, it's a mixture of these kind of climbing activities, running activities, and built into a game for the younger children.
I think just to add, you're completely right, Benny, because we're very fortunate here in that there's so many playgrounds available to kids, and everyone has each playground has a slight different emphasis. So there's some that are very basic level and some that are quite advanced with all sorts of swinging ropes and all sorts of things as well. And they're generally very well maintained. So I think encouraging them children to use those equipments and kind of go exploring. It really helps with their physical activity levels, their coordination, their balance, all sorts of things. And some of these things even have like little climbing walls as well. So, you know, really, really useful. And I think we're incredibly fortunate to have all these playgrounds available to them. So. Okay, so anyway, I think we can close here now. Josh, what do you think?
Yeah.
Yeah.
Yes, I think we can close. I think that's the final question for today.
Yeah.
All right. Just want to thank everyone once again for attending, and we look forward to seeing you again at our next grand rounds of what we call sports medicine series.
Okay.
Yeah, do look out for it. Thank you, everyone.
Okay.
Thank you, everyone.